afternoon, everyone, and welcome to this lunchtime webinar on the report that was done by Dr. Dinesh Balliah of the Vet Center for Journalism and Palesa Deejay Manaleng, a journalist with Prime Media. So the report is Breaking Barriers, a study of people with disabilities in the South African media industry. We will, just to explain the run of the program, we'll start with Dr. Balliah talking about the study, why they did it, and to talk about some of the findings of the study. And then Palesa will also talk about her experience and her involvement in the study. I will ask a couple of questions and then open the floor for questions. So, and I'm hoping that people will, as we talk, they will formulate their questions so that when you're asking a question, it's short and punchy and you're not still kind of formulating it as we speak, so that we can have a nice flow to the discussion. So I will, by way of introduction, Dr. Dinesh and Palesa are the co-authors of this study. Dr. Dinesh Balliah is the director of the Vet Center for Journalism at Wits University in Johannesburg. She has more than 2 decades experience as a teacher in higher education, training, and research. Dinesh is the former Deputy Public Advocate of the Press Council of South Africa and very recently chaired the board of Health E-News and was a board member of the Daycare International Schule, Johannesburg. She currently sits on the board of Report Local. So you can see the experience, the kind of experience and knowledge that Dr. Balliah brings to the study. And we also have the second author, Palesa Manaleng. She is a distinguished journalist working with Prime Media, and she's renowned for her impactful reporting on women and people with disabilities in sports. As a person who's actually participated in sports as a wheelchair cyclist, so she doesn't only talk from just, as an outsider, she's both an insider in disability in sports and journalism. Her work often highlights South Africa's record holders, herself included. I don't know if she highlights herself, but she is a record holder, and breakers in disciplines such as basketball, swimming, racing, and boxing. She addresses topics frequently overlooked in mainstream media. Manaleng's dedication to advocacy is evident through her platform, which she uses to champion disability rights and provide a voice for people with disabilities. Her commitment to these causes has earned her several accolades. So thank you so much for making the time to, share with us your findings to both of you. And we'll hand over to Dr. Balliah to provide some insights on the study, especially about the findings and other thoughts that she had.
Thank you, Jackie. Thank you for that introduction. And let me say a heartfelt thank you for stepping in at a very short notice and agreeing to moderate our discussion this afternoon. So just as a little bit of background as to why we did this piece of work, we undertook the research as part of our work with the Consortium for Human Rights and Media, also known as Charm Africa. And we've been working together for the last almost 5 years. We are a group of human rights advocacy organizations and media organizations working in many parts of Africa. And the idea of working together was really to learn from each other and to be able to, access our different audiences in different ways. We recognize that as journalists, we want to be working more on the ground with local communities, with local actors, and we recognize that those human rights advocates are the individuals who have that kind of access, long-term relationships with community organizations and individuals, and that as journalists, we could learn from that. So the research support came from CEDA, the Swedish International Development Agency, which has supported CHARM over the last 5 years. And part of our mandate was really to facilitate hearing about these variety of experiences of minority communities within the media space on the continent. At the center, we chose to work in South Africa as I had worked with DJ, and I'm going to call her DJ. I know she goes in the professional spaces, she goes by Palesa, but I'm going to go with DJ because I've known her for a very long time. But she and I met when she was working at the Vid Center for Journalism. Um, and I was aware of her advocacy work in the disabled community. She is, of course, a woman of many, many talents, as you've just, I mean, ranging from research and journalism all the way to boxing. And I'd never take her on in that space. But she's a woman who also is known for her reasoned, ethical, and inclusive interview method and manner, which I think we can all learn from. And I was truly, truly honored and very excited to work with her on this particular piece of work. We've talked about doing things together for very many years. In large part, my pitch to work on the disabled community within this broader category of minority communities was really shaped by my experience of working with DJ and just knowing a lot about her life and her, her accident, which transitioned her to a wheelchair. And so I had that experience of her that shaped my willingness and my keenness to take on this project. And while I know many of the struggles that she's faced, she's continued to work in this industry, which is really physically and emotionally draining despite her transition. When we see people with disabilities flourishing as DJ does, I think we often forget about the mental toll that they carry on a day-to-day basis. While we're very concerned in 2026 about mental health in every sphere of our lives, I think that the community of people living with disabilities just really, we don't give them as much regard when it comes to the mental health toll of their day-to-day lives, living with stigma and continuing to live with shame and continuing to work with that. In terms of the method that we use, just very briefly, DJ conducted the interviews among her own network, which I was very, very clear that this is what I wanted, because I really did not want to feel that without my personal experience of life with a disability, I didn't want to subject anyone to my gaze as a non-disabled researcher. I really felt, very strongly about that. Sometimes that speaks to the emotive, and we're not allowed to bring that into research methodology, but I think it's really crucial in this kind of work. DJ and I worked through the data together with her ongoing kind of correction of my phrases, my use of language, discourse, framing, and so on and so forth. So it really was an iterative process between the two of us to make sure that I also learned and came away with a kind of new body of knowledge that I didn't have before. And so it wasn't as immersive, but certainly it was something that I learned from. And I can guarantee you that has the ripple effect of impacting my curriculum. It has an effect of impacting how I speak in the classroom and how we teach and so on and so forth. Along the way, she kind of corrected those phrases, particularly that are normatively acceptable, but are not acceptable to the community. And I think that's incredibly valuable. And so I hope that when people read the report, they can see that coming through, that we didn't kind of recast the reflections of the interviewees into this kind of academic framework that would dampen what the reality of their experiences. We didn't want to dull their experiences and their words and language. And you'll hear, right at the top, we emphasize that we kind of foreshadowed or highlighted the work that the words that they used. The findings overall were very positive, I must say, and it's very surprising, certainly to me, as a person who's not involved in this community. Every one of the interviewees was incredibly positive about their experiences, about their ability to be productive in the workplace, in the media industry. It is a demanding industry, as I've said before. And so to hear them be so positive and really not hampered with the kinds of challenges that they experience on a day-to-day, but they're negotiating these experiences. They're learning to work with what's there, was really surprising to me. I expected to hear a lot about negative experiences, people wanting to throw in the towel and walk away from the industry. But really, these are individuals who are wanting to carry on and to continue to build the industry around them and their own reputations and portfolios inside the industry, despite some of the challenges that they've experienced. So I think the biggest takeaway from all of this is that the experience of people with disabilities in the media depends not only on the kind of official workplace policies that are shaped by national policies, which are in themselves really positive, really forward thinking and forward looking and inclusive, but it really depends on those policies working in conjunction with the attitudes of people around the person with disability. And that was a crucial learning for me, because our official policies at a national level and even our kind of labor policies and so on are very silent on this aspect of the socialization of people working around a person with disability in the media. And yet every one of these positive experiences that we heard about was dependent on the social response of someone next to them, the social response of a manager, the kind of, and it sounds very non-academic to say this, but the compassionate and the kindness that goes into decision making on a day-to-day basis. So just to end off, I think what's really important is that, and this is a kind of outcome of the policy of the research, is really to acknowledge that as much as we do the work in terms of the structural affordances to people with disabilities, we need to do as much work with the individuals working in that same workplace. So as much as we teach people to lead or to manage or to work in teams, we must also teach them to be inclusive in both the professional and social aspects of their workplace, because this, at the end of the day, has an enormous impact on whether a person with disability can be successful or not. And I'll stop there. Thank you so much.
Thank you so much, Dr. Balliah. That was quite a great overview, but also, just some of the nuanced issues that you brought in, especially, especially the elements that you say are non-academic, like compassion and stuff like that. I think we need to make them academic, so that academic stuff is not so distant or cold, seemingly cold, because even in academia, it's people who are working there, people who have love and compassion and all that. So even the publications, the stuff, the research that is produced must bring that kind of language into the publications. But thank you so much for pointing that out. So before I go into the questions, I think maybe Palesa can also bring her experience with the study, and also what she kind of learned, or things that surprised her or things that didn't surprise her, and then we can go into the Q&A session. Thank you.
Thank you, Jackie. When I was doing the research part and I was looking for people to interview, the most important thing for me was to get people with all sorts of disabilities and not just focus on one disability. Because my biggest thing is I don't want to speak on behalf of other people with disabilities. But I did find that it was easier to find women with disabilities who were willing to speak on this project and give their experiences than it was to get men with disabilities. And it was because a lot of the men did not did not see themselves as people with disabilities, which kind of threw me off. I'd be like, "Hey, Chris, would you want to be interviewed for a project on people with disabilities?" I'm like, and they'll tell me outright, "I do not see myself as a person with a disability. I see myself as normal," which is fair enough, because we all get to define who we are in every space. And then there were people who would say to me they didn't want to be part of the research because they were afraid of being bullied. So they'd rather not be part of the research, but they'd have a conversation with me on the side about their experiences, but they didn't want to be named in the research, which was also kind of sad for me, because I think everyone's experience should be documented. And the ones who did come forward, like Dinesh did say, they gave a positive response of support from managers, support from colleagues. Most of the time it was the colleagues who were standing up for them, which is also my experience as well, supporting you at work, making sure that you can work with ease, trying to help you meet your targets of the day. And that was just great. So yeah. I think also because Dinesh said all those things, which has covered most of what the research was about.
Okay, thanks, Palesa. But so the people that you interviewed, how did you kind of recruit them? Did you know them personally? Are some of them your friends? Were you referred to them? I kind of want to know why those
Oh,
specific
okay.
people.
Okay.
Yeah.
So, one of them, Christian, used to be a student athlete when I was a student athlete after my disability. So I met him through that, and I knew him when he came in from high school into UJ to be a journalist student or a journalism student. One of them, whom I used to work with at my previous employer, which was my first experience as a person with a disability, because I worked there immediately after my disability. And then that is where I got to learn about reasonable accommodations. That is where I got to learn about, what I can ask for, how I can ask for it. Because in that space, I think there were six of us with disabilities. We were all in wheelchairs, but also remember, being in a wheelchair does not mean we've got the same disability, So that's where I met Komulema. And the others, it was word of mouth, I pick up a phone and ask an activist and say, I'm looking for people with disabilities. Can you assist me? And they'll be like, actually, I know a certain person. Let me ask them if they're okay with sharing the number. Bradley was a friend of a friend. He's a DJ, so he was a friend of a friend. And that's how I got to know about him and talk to him. But most of them were via recommendation. People as a DJ wants to interview and they were okay with it. So I think in the entire group, there were two of them that I knew on a personal level. The rest were word of mouth.
Oh, okay. All right. Thank you. So I think we'll go back to Dr. Balliah just about some of the just overall questions about VED's Center for Journalism with regards to disability. So I just want to, maybe you can talk to us about the center, other than the work that you've done with Palesa. Is it something that, you mentioned the human rights thing. Is it something that you are conscious about in terms of, students, even people who are employed in the center, accessibility, that kind of thing? We had a bit of an experience this morning coming in. Everything was seamless instead of in terms of access. But Palesa wanted to get me coffee. We kind of saw each other as I was entering the parking. She was coming out of the Uber. She wanted to get coffee, and she offered me coffee, and she's going to get coffee for both of us. But she couldn't bring the coffee up because she has to use her hands, to wheelie herself into the building, and had to get someone. She was coming up when we again saw each other by the entrance, to get me to go down with her because the people downstairs couldn't help with getting the coffee. So that's just one of the things that you kind of notice. You don't think about these things. You just think, okay, I'll get a coffee before I come. But for people on wheelchairs or other people with certain disabilities, it's not that easy. So, but that's the cafeteria. It's not the center. Can you just tell us about accessibility and the center, how accessible it is for students and staff members?
Thank you. So the center is situated within the university. I don't want to focus too much on the center because that's not the focus of the discussion, but the university itself provides a service through the Disability Rights Unit, which is a service that I think is close to 20 years old. The Disability Rights Unit is open to all students with any disability, and I must emphasize that when we're talking about disability, we've got to think about a very wide spectrum of things. Down to, personality disorders, mental disorders, and so on and so forth. So that Disability Rights Unit works with each unit that has a staff member or a student that requires special accommodation. So at the center, and Deejay's been very vocal. I remember the first time she came to visit me when she was in a wheelchair, because she started off before her accident at the center, and then she came to visit when she was pretty fully accommodated navigated in her wheelchair. And she said, well, the ramp is just not the right level. And this is just not right. And I remember, DJ, that you said that the pavement and the door for the actual taxi was just not aligned. And those are things and experiences that we then act on. So the people that are in charge, we can take that forward. A lot of these things, unfortunately, if you're not a person with a disability, you don't recognize them. As much as you try, you really do, rely on the experience of the person who's able to say to you definitively, this is not working out. And so if you're going to say to me now that the coffee shop is not accessible, that's a conversation that I need to have. But the center is not, let me put it this way, we are proactive in not blocking the accessibility of anyone to this place. We want students to be able to come to the center to study as they need. We had in our newsroom on the 10th floor, DJ, ramps installed for a student who was in a wheelchair who worked at the SABC. I think he's still probably there in the archives. He was an honors and master's student for many years, and so our classes would be taken in a space where he could access it, and so on and so forth. The doors are wide enough, and so on. When it comes to other forms of disability that are not physical, this is a welcoming, inclusive space, and this is a space that ensures that you are able to perform and be productive in your studies in particular and your assessments with the support that you need. So, for example, we have a student who has a deformity in his right hand and he can't write as quickly as other students. He prefers to type an exam. So that's an accommodation granted to him immediately, because it's not about how quickly you can do it, but whether you can get your ideas down on that paper in the time that you need to be able to do it. Thanks, Jackie.
Okay, thanks. And just another question on accessibility and breaking barriers. So, I mean, before they get to the media industry, some of them have to study and access bursaries and access universities. So, do you have special? I mean, I know that VET's got a range of bursaries for different people. I don't know. I mean, the spectrum is broad, but are there bursaries that specifically target or are aimed at people with disabilities, maybe in the School of Journalism, or is it just people have to apply at the same level and be taken, using the same kind of standards?
So the bursaries that we have in place are supported by industry colleagues or industry organizations. They support mostly the students in our career entry program, which is a full-time program for students who work in the newsroom. We have never had a student with a disability access that program. And it is not that, the program is deliberately prohibitive, but certainly we've never had an applicant who's requested any sort of or required any sort of affordance in that space. Once the students are recruited or made an offer to study, they are then given access to the bursary companies in order to interview for it. So it's not a matter of preventing them from it or that the bursaries prevent them from accessing it. It's really a matter of we have not had those students come into the place. And I see you nodding and making notes. And yes, I'm making notes that we need to be more intentional in that.
Okay, just one more question for you. So the study, so you and Palesa came up with a study. The webinar is one step in trying to publicize it and getting people to be aware of it. But beyond that, what more are you planning on doing? Any ideas of getting industry, like people, media houses, industry leaders to kind of be aware of this and engage with the findings of the reports?
Yeah, I think for me, and if I could speak personally, there is a paper to be had here about that kind of social aspect that came out of the study itself, that aspect of socializing colleagues in a workplace. I don't remember ever being exposed to training that spoke specifically to working with colleagues with disabilities. I have all sorts of training, in terms of my work and through my career, I've had all sorts of trainings on how to construct a research article, how to teach, how to supervise, and so on and so forth. but nothing specifically around working with a colleague with disability. And I think that's an important part of a conversation that we need to push forward and that we can push forward. And certainly I would be able to do that through publishing a paper or doing more research in this area, making sure that we start to talk about it at a policy level. So what is it that we need to start thinking about? We've got, when you think about health and safety issues, and we've just gone through this at the center in the last week, you get checked on regularly. Colleagues have to go for training, they have to show that they're trained and so on and so forth. But when it comes to issues around, socializing us on how to deal with each other, particularly when someone has an issue that needs to be accommodated, I don't know of any organization that does that work intentionally. DJ, I don't know if you've had that experience in any of your workplaces.
We didn't have any training. When I was able-bodied, we didn't have any training on how to work with people with disabilities. And even now, as a person with a disability, I've never been to work and they said, today we're having a meeting or a conference or where we're going to learn about how to work with people with different disabilities at all. I do know that the National Council for and of people with disabilities does offer a course that companies can apply for. I don't know which other organization does, but I'm pretty sure that every organization has a program for if you're blind or if you're deaf. I just know about them because I've worked with them every few times. It would be great if companies offered training, because most of the time the training is left to us, people with disabilities. I'm left teaching every single person I meet in the newsroom on how to treat me, how to assist me, how to talk to me, not to talk at me. So it would be great if companies were involved. And when policies within the companies are put together, it would be fantastic if they include the people with disabilities. Because what's the point of putting together a policy for people with disabilities and you're all able-bodied? I mean, it's insulting. You're speaking of nothing for us without us. Have us in the room. Let us tell you how you can assist us. And obviously, I won't be speaking for everyone with a disability. So let's invite Deaf SA, Blind SA. Let's have people who speak on invisible disabilities, because I don't have invisible disabilities. Let's have those people in the room having a conversation instead of a group of able-bodied people saying, you know what? I think those disabled people need a rep. And then the rep doesn't work because you didn't consult anyone and you just put it there for the sake of having a rep. I do know that some companies now have started including mental health services for everyone, which is great. So why don't we do disabled training for everyone? How to assist a person with a wheelchair instead of just randomly grabbing me when I'm pushing and say, I'm helping. Have a conversation with them, a human being. Hey, DJ, do you need assistance? Yes, I do. No, I don't. Oh, wait, let me see if I can do it myself kind of situation. When it comes to going out to stories, I'm paralyzed. Obviously, I don't own a car right now. So the most logical thing is to have someone else go with me to a story because I love going to stories. Don't just keep us in a corner and say, oh, she's disabled. Let's just keep her at the desk. There are people with disabilities who prefer to work from home. I don't. I prefer to go to the office. Reasonable accommodations. I think I'm jumping the gun here, Jackie and Dinesh, but let's get into the reasonable accommodations. Every person with a disability is a different need. My needs as a paraplegic is not going to be the same needs as someone with cerebral palsy, someone with bipolar. So have a conversation with me. Hey, DJ, what do you need? And I'll be able to tell you, you know what? I don't own a car, so transport to work would make my life easier, right? Because I'm paralyzed. I'm not going to get up and get into a taxi and carry my chair into a taxi. And also, I don't want to be carried into a taxi by a bunch of strange men that I don't know, So there's that. Someone who's blind, there's software. You need to make sure that they've got the right software. Some people use JAWS, some others use Zoom, So you talk with those people, understand what their needs are. And my thing is, if you can buy software for a company for any other thing, why can't you just add the JAWS for that blind person and update it the same way that you update any other software that you have within the company, right? because the same work that an able-bodied person can do, I can do differently, but I can do, right?
Yeah.
At my own pace, but I can still meet my targets if I'm supported and if I've got backing from managers, from editors in chiefs, you know.
Okay. Can we
Yeah.
pause?
Okay.
Because I just have a couple of questions and then we'll open. I don't know if some of the people who were in the study, who were interviewed in the study are part of our participants, and if they are, we'd also like to hear from them. You've talked about your own experience with disability already. I mean, I was going to ask a question about your own experience and you went over and above. But, Dinesh mentioned something, the whole thing about socializing, the whole thing about socialization, right? Because it's not enough to have you can access your workspace and it's fine. But if, for example, like at work, how accessible is the kitchen to you? Does the person who's washing the dishes or tidying up the kitchen know not to put, all the cups at a level that you can't reach, or, the microwave? Are you able to warm up your food yourself? Things like those. What are your experiences with other things that, are not normally, because once, we've got a disabled toilet for her workspace is accessible, her wheelchair can wheel around, the newsroom or whatever section you work in. But what about other kind of social spaces in the workplace? Are they also accessible in your experience?
Oh, yes. So at my current job, when we moved to a new building, my former editor-in-chief, Brasbu, when we moved in, yet the people who were building the building take a wheelie around with me, the entire building and maintenance, and ask me what works, what doesn't work. So I pointed, this works, this doesn't work, this works. And they made the changes, right? Things like the water, I don't know what you call it, where you go get the water.
The water fountain type of thing.
Water fountain. Yeah. It was too far, and then they moved it closer. My desk is specially made for me. If you come into the newsroom, I'm the only one with a specific desk. When it comes to going to the kitchen to get hot water, because I can't carry hot water on my own, I'm gonna get burned. My colleagues, I got great colleagues. I just need to ask one of them, and they'll go with me to go get the water. When I go to the cafeteria, they'll go with me to the cafeteria. But also at the cafeteria, they're willing to come up and bring and bring my food. So I've I don't know, I guess lucky, or I'm blessed, but my colleagues have been my backbone when I'm at the office. I don't have to worry about anything except doing my work and making sure that I perform the way that everyone else performs. A silly example, it's not silly, but I get Uber to work sometimes. And this one time the car was too low and the driver wouldn't assist me the way I was telling him to assist me. He kept telling me to stand up. I haven't stood, it's going to be 12 years. I haven't stood up in 12 years. He keeps saying, Sisi Suhuma. And I'm just like, can't stand, just assist me the way. And I just took my phone and I called upstairs and I said, Tola, please come help me. And she came down with Dominique. And the first thing they asked me was, how can we assist you? No one taught them that. That's just the kind of colleagues I had. How can we? And that man is standing there looking at us like we're doing something out of this world. So my workspace accessible thanks to my colleagues.
Okay.
So Jackie, I wonder if I could jump in there.
Yes.
I do want to say that we must accept or acknowledge that the blind spot in the study is that we did not get people who reflected on negative experiences.
Yeah.
And in doing so, we also didn't then get to hear about the people in the workplace who have not supported people with disabilities. And so we must be very cognizant of those kinds of negative experiences, that kind of stigma and, lack of socialization of dealing with people with disabilities, which is a blind spot in the research and something we need to bear in mind when we are swayed by such positive reflections.
Yeah.
And we have a lot of bad experiences. I've had them as well. So I agree with Dinesh. We do need to tap into that because then there's a balance to the report. But like I said,
I mean, the positive reports can be the positive responses or the positive kind of outcomes of the findings, so the reports can be used at least as guides or benchmarks for what is good practice, good workplace practice. If when Dr. Balliah talks to her peers in the media industry and say, well, some other places have done it, and these people say this is how they would want to be helped. I mean, the experience of your Uber is actually what was happening when we first met in the aeroplane, and they said, we didn't know each other. We were going to the same conference, but we kind of met in the plane. And when I started fighting with the people, like, okay, you brought her in the wheelchair and you're saying she must move over. Like, how is it going to happen? And that's how Palesa and I met. But also, just another question is the question of language, again, that Dr. Balliah mentioned, because some people don't want to be called people with disabilities. Some people, like you may want to be called just a paraplegic. It's another label. Other people don't want to be referred to by their disabilities because then they get essentialized. Like if you're on a wheelchair, it's like, you can't do anything else, or you can't think, or you're not smart enough and stuff like that. But for, just for navigating the world for both abled people and disabled people, do you think names, words, language, like labels are necessary? Because usually, the norm is the unmarked. Once there's a mark, there's a thing that's already stigma, like Dr. Balliah says, or also just essentialism, where your disability more than a whole person. So what are your thoughts on the language and naming and labeling issues?
Language is very important. It is very important because it also influences how people view you, and also I think it's a sign of respect. Some people don't want to be called disabled, they want to be called differently abled. When I spoke to Charlie in the report, he said, I'm not visually impaired, I'm blind.
Yeah.
And he's got every right to say who he is, and how we should address him. I've had an experience where I was at a mall and an elderly man said to me, "Oh, you're so happy for someone who's handicapped. Don't ever use that word with me." I find it very offensive. So language is very, very important because it can either make a person or break a person. And the most important thing to do is to ask a person, how do you want to be addressed? I see myself as a person with a disability and also as differently abled. So I'm happy. And also I'm a paraplegic. When we're going down to the finer detail of things, when you ask me, so what is your disability? I'm a paraplegic. I'm a complete paraplegic. There are people, like I said, who do not want to be identified as disabled at all. Whether you can see that disability or not, to them, they are not disabled. And we respect that, And even when they apply for jobs, they would not put the word disabled there. I agree with them, but also I don't also agree with them. I agree in that they've got a right to say who they are and identify themselves, but I don't agree with them because when you're applying for a job, then you don't give the company an opportunity to say, actually, TJ, our building is just stairs. We don't have a lift, right? And then I get to an interview and there's no lift. And the first thing I do is on social media, hashtag such and such a place is not accessible. But I did not say to them, I'm a wheelchair user, which is unfair on them, right? So there's that. Or I'm deaf. And I don't give the interview panel a heads up. And we get there and everyone's quiet. There's no sign language interpreter. We can't communicate. And I go back again and I talk about how people are discriminating against me. But you didn't identify your disability because you don't want to be seen as disabled. So I think there's a fine line. There's really a fine line, right? It's...
Okay, so I mean, I think it's a very complex issue because when I was doing my teaching, we were taught something called universal design for learning. So you prepare your lessons for everyone. You don't do a special school kind of lesson. You design a lesson that's going to be suitable for people who are deaf, who may be deaf, people who may be blind, people who may not be able to take notes or something. So is it just a dream that buildings should be universally accessible so that people don't have to, report that I'm on a wheelchair because I'm going to need access? I mean, it's another limitation. And if you put that on your job application, or when you're coming for an interview, but already put you in a kind of a disadvantaged position unless the company is intentional about employing people with disabilities. So there's just some issues that could even work against you when you want to be upfront about your disability. I don't know what employment equity and the Constitution says about overall and universal accessibility, but so those are some of the struggles that we would deal with, because you don't want to say hashtag building not accessible, or you don't want to say parking not wheelchair friendly or something like that, but shouldn't that be the norm kind of thing? I don't know.
Look, Jackie, that's the dream. That is the dream, that everything is accessible, right? And I do know that the government has said their buildings are supposed to be. You hear me? Are supposed to be accessible. Supposed to be accessible, which is not always the case, right? Because also I think even they have not gone the extra mile and said, you know what, as the Department of Women, Children, blah, 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 and people with disabilities, let's have people with disabilities in that department who advise us, right? And as a Department of Infrastructure, let's have people with disabilities who advise us, right? Because you can go to let's say a home affairs, and like any human being, I need to go to the bathroom, but the bathroom is upstairs. The lift is not working, right? You carry me up the stairs. I can't enter through the door of the bathroom, but it's got a sign of a wheelchair there, which is the universal sign saying that it's a disability bathroom.
Okay.
Because no one had a conversation with people with disabilities. Oh, I'm blind. You know what would make life easier for people with blind people? If there was a map in Braille of the building that they could feel and know where the bathroom is, right? You get in, you feel, oh, the bathroom's on the left, or the bathroom's on the right, or this office. But there isn't that. You know why? Because in the departments, the governance, there isn't people with disabilities there. Or you hire people with disabilities with all the qualifications and you say, we're going to make you a receptionist. There's nothing wrong with being a receptionist. There's nothing wrong. But you cannot put every disabled person you hire as a receptionist while in the rooms making decisions. The same way in media houses, why don't we have people with disabilities in positions of editor-in-chief, in position of CEOs? Who at the top is speaking on behalf of people with disabilities? Who at the top is saying, how do we assist this person to become a better manager? A better journalist? What is the plan in those media houses? And also you cannot be a media house in South Africa where you're holding people accountable with one person with a disability in your newsroom, or no people with disabilities in your newsroom, but you're telling stories about people with disabilities.
True.
How are you telling? I mean, it doesn't make sense to me, right?
Yeah.
We can go back to, yes, there are not a lot of people. There are very few people with disabilities in tertiary institutions. Everything's interlinked, right? So those institutions should be accessible as well, right?
Yeah.
They should be accessible so that we can get more people with disabilities. And I'm not saying hire me because I'm disabled. No. If I've got the qualifications and I've got the experiences, why aren't you hiring?
Yeah.
You understand?
Yeah.
And if there's an issue of we don't have this and that, ask, my guys.
Yeah. Okay, Balliah. Okay. Let's give. Okay, let's open. You can go on all day. Let's open up for questions from our guests and have some engagement because just while you drink your water and cool off a bit. But it's true that we do need people. We do need people with. I mean, like for example, you don't speak for all people with disabilities, but already through this study, you've engaged with a couple of people, and there's some ideas about what blind people are struggling with in workplaces, what people with let's say mental health issues like bipolar. I mean, I saw in the study, the person was like, when is it going to go away? When are you going to be okay? When are you going to stop having bipolar disorder kind of thing? So we do need that. We do need people, if at least if not someone who, you can't represent everyone, but at least you have experience for having talked with all these people. And that leads to my question about, is there an advocacy organization for people with disabilities in the media? If there isn't one, if there's one, we can talk about it, you can mention it, but if not, maybe something that we also need to think about. So we'll take questions. I can't see the participants.
There is a question in the Q&A. Shall I read it?
Yes, please.
Okay, so this is from Priya Ranchoth, and it says, this is a question for Palesa. Coming from a journalistic background and sports fraternity, have you looked at ever building parasports? Sorry, I just need to move this. Parasports in the media, especially sports like table tennis, which is seen as an amateur sport in South Africa and doesn't have major media recognition. So, Palesa Deejay.
Yes. So I do cover a lot of parasports on our website. If you follow me, or if you go read EWN, you'll do find that a lot of my stories are about para athletes. As for table tennis, I actually don't think I've covered that. I'll put it on my list and I'll look into that. And I've seen that there's been a pickup in other media houses where they do cover a few para athletes. And also, you must also remember that the para athlete scene, the para sports scene, has shrunk a bit since I've competed, because I competed 2015 to 2021. It's because of funding, right? It's because of funding, and also the federations don't communicate with media at all. So to get the stories or to get the athletes, for me, it's because the athletes call me, or the coaches call me, or the parents call me. Or for my athletes that I used to compete with, they'll be like, hey, this and such an athlete is performing. I'm like, give me their number, let me get hold of them. Surfing South Africa now, the para athletes are struggling to come from Cape Town to Durban to compete at the national, competitions, because there's no funding, which is a continuous thing in para sport for as long as I've been disabled, and I've been disabled for 12 years. So to answer your question, yes, I want to cover the table tennis, but also the federations need to come to play and give the media access to the athletes, tell us what's happening. Because if I don't know what's happening, I can't report on it.
Yeah, and some of the coverage is limited only to, the exceptional athletes who are winning Grand Slams and so on. And when the rest of the colleagues who are working in leagues are trying to get that kind of coverage, it's completely silent.
Mm-hmm. Which is very sad.
It's also, beyond it being sad, it also has the ripple effect that those individuals don't build a reputation through the media and don't secure the kind of funding that, other athletes would be able to secure. So there is a ripple effect of not having, the kind of coverage that everyone else enjoys.
But also, this is where, sorry, Dinesh, this is where the Department of People with Disabilities should be coming in as well, and also where the Department of Sports should be saying, okay, we've got funding for development of para sports, because that's also a big thing. People can't be what they can't see. So if they're developing the sports at grassroots and putting money into the national championships and putting money into these athletes to get them to competitions and having more competitions in South Africa. I think in South Africa we currently have 2 national championships, and otherwise you have to fund yourself to go overseas and compete. How does that work? And you have to also consider the equipment depending on the sports. Every sport has got different equipment, and also that equipment needs to be made to your body as well to make you comfortable so you can compete. And then there's the coaching. How many coaches are there that cater to people with disabilities? We have so much work to do. So, yeah.
Okay, just another question. So, I mean, to bring it back to journalism and the kind of thing that we do. I mean, you've talked a lot. I mean, what you've talked about is, there should be experts in government, in different departments, making sure that at least when there's, that practice kind of matches legislation and all these wonderful laws about inclusivity and all that. But as a disabled person, sometimes we kind of expect, it's usually the case even with women or people people who are marginalized. The burden of educating people all the time falls on you. Like, you're a journalist, right? You go and do stories and all that. But, along the way, you have to educate people about how to treat you, how to do this. Do you think, I mean, I don't know, because you seem to know. So there's a whole thing about you're the expert. But what do you think of that kind of approach to when you raise issues about lack of accessibility and people say, well, teach me how to treat you or show me how to do it. Just your thoughts on that. Because journalists go and do stories, right? They do stories about anything they want to inform the public about. They do, if somebody wants to talk about Julius Malema, they'll even go to the trash and search the trash for evidence, But why can't we get journalists, able-bodied journalists, to actually do stories that, you follow a person on a wheelchair just for a day, let's go to Maboning for a day and see what happens and the rage that you encounter when you see people parked on ramps and people taking up parking and stuff like that. And it always falls upon you. But do you have to educate people? What are your thoughts on that? Especially in the media, like, why are we not seeing more of those stories, that should be of public interest? And I suppose that they would maybe also address what Dr. Balliah kind of raised about socialization, because it can only happen in journalism schools or, in tertiary education or in school. But also, generally, the media has a role to play in socialization. Yeah.
I think it's unfair. It is unfair that I'm expected to teach my peers, adults, how to treat me. I'm a human being, the same decency that you afford another human being, you should be able to afford me as a person with a disability, right? And I think also we're hypocrites because we hold other people accountable when we report on our stories, but we don't know how to hold ourselves accountable, right? We write stories about how other institutions are not fair, they're not doing this, they're not doing that, and we don't do the same. And besides following me every day with a wheelchair, why don't you just, the way you, like you said, the way you research Julius Malema, whatever, why don't you just do your own research, on disabilities? And then you can come and say, actually, DJ, I read da 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 da. Is this what you need, or is this not what you need? It shouldn't be like when I need the most basic thing, then I must explain my life story and why I was disabled. It doesn't make sense to me. And also for the way that we report disability stories in the media, we have made it a thing to only report on disability when it's a autism month or blind whatever month. Are we not disabled the rest of the year? Am I only disabled on National Wheelchair Day? The same issues that you face as an able-bodied person, I face them. The price of petrol affects me as well. The price of groceries affect me as well. Access to education. When students are doing for free education, are you considering the kids with disabilities, what their needs are as well, right? So things that, when you're talking about healthcare, I think I've had a conversation with you and Dinesh about access to healthcare, when I've tried to go get an AIDS test, and a nurse laughed at me because, oh, what do you need an AIDS test? Things like that. Those are stories we could be looking at, and also we must remember that the media shapes society. And because we don't report properly about people with disabilities, and we write token stories and write inspiration porn. Society also treats us the way that the media portrays us, right? We can take it a step further where, let's say, the movies where we have a main actor who's a person with a disability, but the person portraying them is an able-bodied person. And there's always this theme of getting cured from their disability. They were in an accident, they couldn't walk. A scene later, they're walking, it's a miracle. Life doesn't work like that. There's nothing tragic about being disabled, right? And it shouldn't be portrayed as if it's tragic. There's nothing tragic. Everything that everyone else can achieve, we can with just a little bit of assistance. So I think if we change the way we report on stories, that is where we start as editors in chiefs, And also another thing is there's a whole thing of, oh no, these stories aren't important. They are important. They're just as important as political stories.
Yeah. Okay, so let's get Dr. Balliah also kind of commenting on how journalists are trained, right, to cover the broad spectrum, and also in their role as educators or part, of enlightening people or creating awareness about all issues across the spectrum of life, but also just the whole thing about exceptionalism, right? Like if you win, an award for Best Journalist of the Year, then it's exceptional. Palesa is a superhero. Or if we see someone, I don't know if she's here, but Khumulemo, you see Khumulem everywhere. Like when you go to the market theater, she's there. When you go, she's just living her life. Like she loves theater, but when she's there, it's like, wow, it's a marvel. How did you come here? How did you? So the whole thing about making disabled people, every little normal thing that they do, it's superhero stuff. And that's the kind of reports we get in the media. I don't know if it's how you're trained. Maybe it's attempts to give them publicity, but it can be also problematic, right? Because it's, again, kind of exotic way of, or a sensationalist way of reporting. So I would like to hear, as we approach our closing time, just Dr. Balliah's thoughts on this.
Yeah, thanks for that, Jackie. So much of what Palesa has said is really the nub of this project, is really what this project was about and meant to surface and meant to allow us to engage with. So I really thank her for, reflecting on her own experience in the last couple of minutes, because it's helped us just contextualize the project a little bit more. The reporting, certainly, it's not just an issue of fetishization of this community, but of all minority communities. If you think of people living with any particular disorder or whatever it is, they are fetishized in that way, in that their exceptionalism is, stories are exceptionalized around their triumphs and so on and so forth, and their day-to-day is rendered basically invisible, right? We don't ever hear about them until they are successful at something, or there's a triumphant story to tell about it. Some people may call that the fluff that we use to make people happy at the end of the day when we're reading about all the kind of depressing political news that we are reading. I was very surprised to hear so many people, and I didn't reflect on this with DJ, but I was very surprised to hear so many of the interviewees reflecting on non-disabled actors being used as disabled characters in television. And, what resonated with me is a sense of representation, this sense of wanting to see yourself authentically represented. And in that way, these interviewees were not talking as professionals. They were just talking as ordinary people who consume the media at the end of the day. Oh, sorry, I see Fadila says she can't type a question, can't type a lot. Stuart, are we able to let Fadila speak?
Yes,
Is that
definitely.
possible? Okay, can you unmute? I'm going to just make space for Fadila. And if there's anyone else, Fadila, you can unmute. Thank you so much.
I'm unmuted, thank you. And let me just say who I am. I'm disabled. I've been disabled for 40 years.
a quadriplegic because of a car accident. I've been in the disability rights movement for many, many years, and an activist, a very active activist. But the first thing I'd like to say about your research is that perhaps if you made it anonymous, you would have gotten men to interact or to participate in your study, and those who wanted to be named could be named, and those who didn't want to be named should have had the opportunity to remain anonymous.
So to respond to that very quickly, that opportunity was given to every single person who engaged, the option to remain anonymous. I know DJ said otherwise at the beginning, where they declined on the basis of being named, but that option was made available. You'll see in the report, in fact, one of the interviewees remained anonymous.
Okay. It didn't come across that way, but thank you.
Thank you.
Then in terms of naming or whatever you want to be called, my attitude to that is that, yes, everybody's got the right to refer to themselves however they want to, but when we write papers and policies and whatever, as a country, we subscribe to the international regulations and conventions and etc. So I personally don't use people with disabilities. I use disabled people because I believe that it's the environment that disables me and not my impairment. So, but when we do policies and we do national stuff, we need to refer to it as those conventions that we have signed as a country. And I do know the United Nations Convention refers to people with disabilities. So whenever we do national things, I think that's what we should use. But in my personal capacity, I use disabled people. And in my writing, I also use disabled people. And yes, coming to the media, it is so important for language to be used properly, because I always make the example that how black people were referred to previously, if we still used that word, very little would have changed. Now, until we also refer to disabled people appropriately, things won't change. Like you're talking about the hero and you're supposed to be superhuman and all of those things. It's the way media frames and portrays people. Like the moderator said, when a disabled person appears at a theater, it's, oh wow, she's out. So we should also just be mindful of how we portray and address and speak about disabled people in the media. And you were right, DJ, to say that it's not my responsibility to teach the whole world. I did an MBA, and mine was barriers to employment, and I also had a preconceived idea of what the outcome would be, and my thoughts were it would be about barriers. And to my own surprise, I found out it was willful ignorance when I did my analysis, because there is a lot of information to be had. And you're right when you say, why don't they do their own research? Because there is information to be had, but they make it your and my responsibility to teach them. Yes, there is a space and a place for that, but it shouldn't, the onus shouldn't be on me to make people know about disability. Thank you. Yeah, I know the time is up and there's a lot more to say.
Thank you so much, Fadila.
Thank you for
We
the paper
appreciate
that
you.
you
Thank you so
released.
much.
And yeah, I'd like to go through it some more.
We appreciate your insights, especially around the language thing, because it's important to know, okay, if people have different preferences, but when we talk about the issue universally, what language do you use? So that's quite appreciated. I don't know if there's anyone else. There's questions. Otherwise, we can bring the session to a close, and maybe Dr. Balliah can close for us. Have final words.
Oh my goodness, I didn't really expect to be closing, but thank you so much, colleagues. On behalf of the Centre, really, Jackie, thank you for stepping in. DJ, again, it's been a pleasure to work with you. I'm so grateful that we've had this opportunity, and I hope we can continue with some of this work. Hint, hint to any funders who are listening out there who wants to support this kind of work. And then let me just say thank you to Stuart, who's been managing behind the scenes, and to all the colleagues who assisted, especially Dr. Tandi Bombi, who was the proofreader on this project. Thank you once again. I wish you a good afternoon, and I look forward to seeing you on another one of our sessions.